work is not only what you do, but also how you do it. In today's episode, I'm going to be joined by an orthoclinician who is going to tell us how exactly this happens. Yes, you're most welcome, Doctor.
Yes, thank you so much, Vivian, for having me in this space as your guest. I'm so much honored to be part of the Everyday Health podcast, and we shall be discussing a lot. Thank you so much.
Yes, Doctor, could you kindly tell us more about yourself?
Yes, my name is Mr. Mugabi Benjamin, and as you mentioned, I am an orthopedic clinician by profession, as well as the founder of OrthoPulse Wellness Hub. That is basically an initiative that is in place to echo a voice out there to the public about awareness, advocacy in regards to their musculoskeletal health, especially outside hospital walls to everyday life.
Okay, Dr. Benjamin, what is musculoskeletal for our viewer out there?
Yeah, that's true. Now, to break it down in simple terms for our viewer and listener is that a musculoskeletal system is basically the system of the body that includes the bones, the muscles, the nerves. So anything that has the weight of the body in terms of the bones, the muscles, the nerves, that whole system that is working together in terms of mobility, in terms of sensitivity, all that is the system that I'm talking about. Yes.
Oh. So, Dr. Benjamin, let's talk ergonomics.
Yes, that's the reason as to why we're here, because you earlier mentioned about if work is about what we actually do, but also how we do it. So it is something very broad, and it would strike a mind of someone out there, be like, work ergonomics. It sounds to be a very, very vocabulary term, but I would want to break it down for our dear listeners today. So to start with, basically, the word work ergonomics. These are two words, but I'll focus more on the ergonomic bit. When you say work ergonomics, we're basically dealing with ensuring or helping our listeners to know about the science that is in relation to what they do, especially the things they do, the tasks they do, the environment they live in for that period of time, and how they fit it to their body in that it does not affect them. So ergonomics, to break it down, is ego and nomos. That is the Greek language. But ego means basically work, but then the nomos means the norm or the law. So we're talking about the law of work. So it is not complicated as it may seem like. It's just you trying to fit your body to the work that you're doing.
Yeah. So Dr. Benjamin, I'd ask myself, why does ergonomics even matter? Why is it of importance?
Yeah, that is true. Thank you so much. Because otherwise, someone would not have time to listen to this if we don't actually mention why it actually matters. So work ergonomics, as I said initially in the definition or trying to say what it is, basically we are talking about how you're going to use your workplace. Okay, we're talking about a place that you're going to be in for 6 hours. You're going to be mentally focused towards something. So there is a lot of, how should I say it, you trying to drift away from your body and focusing on what you're doing. So to start with, I would mention the prevalence or the statistical bit of why actually this topic matters. Because when you look at, let's say, the office workers, averagely 10 of them, 6 out of those have pains, musculoskeletal disorders because of work ergonomics, okay? And surprisingly, when you dive deeper, 1 out of the 6 do not know about this information. Okay,
they do not know why it's even happening in the first place.
And maybe they just come to the hospital, present to us, we treat them, and then we tell them, you know what, I think you have a problem with your workplace, maybe the way you're doing this and that. So that is why it actually matters. And also, I would mention that it will be a disservice to talk about why it matters if I have not mentioned the consequences that usually happen. Okay, now so many people out there have what they call work-off days, but it's not a work-off that maybe you're having leisure, but you've asked for a sick leave from maybe the sort of facility or workplace because you're having a lot of pain.
You're fatigued.
Yeah, you're fatigued. You're having a lot of joint strain, a lot of back pain. So sometimes we don't easily get to know the cause of this, not until you come to the hospital and then we tell you that, you know what, I think there's a problem with what you're doing in your daily life. So work ergonomics as well has consequences. That is mental fatigue. You talked about it. There is absenteeism amongst workers, asking for sick leaves. There is also strain of the body, muscle pain, joint, shoulder, wrist, back pain. All those things account for poor ergonomics at our workplaces.
So, Dr. Benjamin, we're talking about the pains. Are these pains like, are they like acute? Like, do they happen there and then, or are they chronic? Like, they develop over a period of time?
Yes, that's a very good question, Madam Vivian, because from the time I've interacted with most patients, let's say an instance of someone coming to the facility, okay? This is someone that is not even so old. I'll just take an example of, let's say, a middle-aged adult, let's say 35 years or 20 years, that is already working. And they are complaining of back pain, okay? This even us as medics, it strikes a nerve to be like, why is this person presenting with these complaints? Because usually those complaints are age related. There's what you call wear and tear. So when someone of that gender, or sorry, that age comes to us, it always reflects much more of what they do. So we actually ask of them, what actually is your work? So some of them, you find they're office workers, they're behind the desk every time, bank tellers, maybe these people who are doing administrative duty. So always they have that pain and then they come to us. So it always helps us, or it helps them to know the cause of what the actual problem is. Because even when we treat those patients, after we've given them medication, we emphasize about lifestyle modification in regards to their workplace. So the pains, they usually come about the strain, the mental fog, a lot of things that come about with you not minding how you do your work.
So, doctor, like you've mentioned that this is summative. It happens after repeated action is taking place.
Yes.
So, what are some of the actions we do at work that bring about such pains?
Okay, yeah. You've mentioned about chronic and acute. Now, just to break it down for someone out there that is listening, anything that is acute usually happens like onset. Let's say you've had an injury, an accident, and then you have a fracture or you get a bruise, you feel the pain instantly. But when you talk about the chronic pain, this is the one that builds up. And it is not usually so much at the start. That's why when the patients come, they say, I started feeling some pain a month ago. It was coming and going like that. So, but it has a trajectory it takes. It builds up over time. So at the time when someone comes to the facility or the hospital to seek medical attention, that's the point when it's unbearable, okay? So that is chronic. And most of the work-related musculoskeletal disorders, which are WMSDs, they have that trend. Their pain is gradual and it gets chronic. So that is something. And by the time you come to us, sometimes you need advanced treatment measures, unfortunately.
And this can all be prevented if a workspace is designed to
Exactly.
to fit your work.
Yes, please.